they end up spending everything out of pocket anyway. And
True.
so they,
True.
if you break down, a direct care visit, and you compare that to everything that would have been billed out to the
Right. Right.
insurance, and
It's
then the
better.
applied co-insurance deductible and all that,
Better.
even if they have partial out of network benefits, the net out of pocket can be the same.
I
It's
agree.
it's really kind of
I agree.
impressive. Like
I agree. And I
I I have a lady who, yeah.
okay, so I'm glad we're live. We're gonna go live now, and I'm so excited that we're having this conversation. And I like, what we talked about, off screen, of course, that you're doing that because it gives people more options. So this is great. So that being said, hi everyone. Good
Mhm.
morning, good evening, good afternoon, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinton. I'm the CEO and co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas. And I'm excited today to do another Facebook Live. And I'm talking with the one and only Dr. Lindsey VanDyke. She's an endocrinologist. And we're talking about the topic, Doc, I have type 2 diabetes. Help me to control it. And of course, we're having talks with an endocrinologist. If you're watching live, hashtag live. If you're watching replay, hashtag replay. Doc, thank you so much for coming. How are you doing today?
It's my pleasure to be here. I'm thrilled to participate in kind of open forums that patients can access easily, because there's a lot of questions that you just don't have time for in any given visit. And these are good forums to kind of go through some of that stuff. I'm doing well today. We had a nice, robust clinic day today, and as per usual, it was dominated by diabetes. So let's talk about it.
Yes, yes. So kindly introduce yourself. Who are you and what do you do?
I'm Lindsey VanDyke. I'm a board certified endocrinologist. I'm also board certified in internal medicine. And I founded the Advanced Institute for Diabetes and Endocrinology in 2021. And what we aim to do is really set the gold standard for general endocrine care in the southern mid-cities portion of the Metroplex. And I really believe, this is a shameless plug for my team, I genuinely have the greatest team. We all work like a well-oiled machine, and I have very brilliant women working with me, and we take good care of patients.
Awesome, awesome. Doc, I'm curious. Why do you do what you do? Why did you choose this field?
Well, I guess, as they say, like the thug life, endo chose me. I kind of accidentally stumbled into it in residency. I unwittingly became the de facto diabetologist on the residency team. And when there was problems with inpatient insulin dosing, I was your lady. And um, as I got better at that and began to kind of participate in committees with that hospital and kind of enhance the safety profile of how we manage diabetes in the hospital, my attendings kind of kept saying, "Well, you're going to go to fellowship, right?"
Right?
And I said, "Okay." And so I kind of had applied to fellowship, almost not even having an expectation that I would be accepted to one. And then I matched to fellowship, and here I am
Wow.
today, living the
Wow.
life.
Wow. Well, we're thankful that you made that choice. I'm thankful you do what you do to help people in the local community and even beyond. Now, my next question, we're going to start off with this. Like, what
Mhm.
are generally the best ways to manage diabetes for someone who's asking, like, okay, I agree there's medicine, there are things to do, but what is the best way? And I know that's a loaded question. Of course, these are medical
Yeah.
suggestions. We do recommend people make appointment with their own endocrinologist to discuss. But what would you say generally?
Mhm.
Okay, I have diabetes. Doc? How do I manage this?
Yeah, your point is well taken. You know, what is the best way? And the short answer is that entirely depends on who you are, how long you've had diabetes, and what other complications may be in play with diabetes. But if we're talking about generalities, I will say first off, one, this is not grandma's diabetes. We have incredible technology available to us and very, very smart medications that when we intervene early and aggressively, and we're hitting the disease from as many underlying components as possible, then this issue of kidney failure or dialysis or amputations or numbness and wounds on feet and legs, those stop being issues. And I'll say in general, the single greatest thing someone can do is aggressively intervene when there is the pre-diabetes stage. It's really a misnomer. It really should be called phase 1 diabetes, because the changes that happen to the heart and the vessels and the nerves is happening already. And the greatest payoff happens is when you are starting medication in that phase.
That is powerful. Not waiting till you actually have the actual diagnosis, being a little bit more on the preventive or aggressively treating in the pre-diabetic phase. I can't tell you how frustrating I've seen it is to see that people have been pre-diabetic for a long time, and sometimes they don't even know it. They don't even know that that's something they have. Oh, it's pre-diabetes. I'm not diabetic.
Most times they don't know it.
A lot of times. All right. My next question. How often, someone's asking, how often should I be checking my blood sugar to make sure that it's managed? What would you say to that, Doc?
The answer to that question also depends on, you know, how bad it is, which medicine or medicines you're taking, and how long you've had the problem. So, for example, if someone is, let's say they're a fresh diagnosis of diabetes, and they just got told that their A1C is 11. 11 is bad.
Yes.
Double-digit A1Cs require a lot of intensive work. And you can get them down, but those initial phases require a lot of monitoring. And typically when you have an A1C that's that bad, you're going to be dealing with insulin, usually multiple injections a day, at least for a short term. And when you're on a regimen like that, you really should be getting blood sugar data 3 to 6 times a day. And so, you know, in the old days, all we had were finger sticks.
Right.
You know, it was a real pain. And I still make my medical students do that. They practice like they have to do it the old way 4 or 5 times a day so they know what it's like. And now with modern technology, we have sensors. And so if you're needing intensive therapy, we have a sensor on, and it's getting data every couple of minutes, all day long, every day. And it's wonderful because you cannot escape us. We can see everything, you know. Now, if you've had, you know, pre-diabetes, it's been smoldering maybe for several years, you haven't had any major spikes, your A1C sitting there at 6.3, 6.4, whatever, then you probably only need to be checking that maybe once a day, maybe once a week. Again, kind of depends on which medicines you're using.
Awesome. I love it. Now, my next question is this. I have someone who's watching who's like, all right, Doc, I get it. There are medications, there are things I have to check. I got to obviously see my doctor and make sure I manage this well. But for someone who's watching who's like, are there lifestyle hacks that I can use to help maybe better control my sugars? What would you say to that?
Yeah. Back in the days of yore, before we had insulin to treat diabetes, we did have an appreciation that carbohydrates, that macronutrient carbohydrates, were responsible for these big spikes and changes in blood sugar. And so back in those days, it's like you could control your diabetes by carb restricting, and that's all we had. Um, and the same is true now, because it's interesting that glucose, which is the molecule of life, that is the food that every one of our cells has to have in order to live, that is by definition carbohydrate. But it's the only macronutrient that you don't actually have to take in. This is why the Atkins diet works. This is why keto and paleo, these things work, because you consume these other macronutrients, protein, fats, and so on, and your body has other metabolic pathways to use those resources, and then they make glucose out of it, and that's how they feed the brain and the heart and everything. So carbohydrate restriction will affect blood sugar lability, how much roller coaster you're doing, and prioritizing protein intake. And this is true with weight as well. If in doubt, take in protein. If in doubt, pump some iron, be metabolically expensive.
I love it. Aim for the protein, even for weight loss. It helps too.
Yeah.
All right. My next question is this. Now we hear about the complications associated with diabetes. And of course, people come in nervous. Oh, I don't want to have my father had kidney disease, or had to go on dialysis, or they had to have their foot amputated as a complication of uncontrolled diabetes. I know this sounds a little redundant, but how can we prevent complications if one already has diabetes? Like, is it you're diabetic? You're doomed to having this. What would you say to that, doc?
No one's doomed to have anything. And again, I'll kind of go back to this idea of modern diabetes technology, which continues to just evolve at incredible rates. Number one, again, let's go back to sensors. When we do nothing else except give someone a sensor that allows them to see in real time what is happening in their own body, and then accordingly take evasive maneuvers, we can lower an A1C by 2%. That's without any meds. That's just awareness and attention to lifestyle. Now, to kind of go back to the idea that these chronic changes are happening early in the course of disease, and the longer the disease is there, the harder it is to kind of make up for that or resolve these problems. But again, the types of medicines that we use in combination really are catching it from all of these underlying problems. And we're protecting the heart, we're protecting the kidneys, we're protecting weight and insulin sensitivity. And we didn't have that kind of technology only about 10 years ago did it really get good. And so I have this philosophy that people who maybe they're 40 years old and they're being told they have prediabetes now, by the time they get to be grandma's age, we will not be looking at those complications. I'm actually very interested to see what will happen to the rate of diabetic kidney disease in the next several decades, because it's just in the last 10 years that we have gotten a hold of medications that can actively prevent progression and reverse diabetic damage to the kidneys.
Awesome. So you've heard it from the expert, from its specialist, saying just because you have diabetes does not mean you're doomed, or because if there's a family history. There's a lot of technology out there that helps us with monitoring. I'm actually very excited to hear the data on just monitoring, having awareness of how your sugars change based on what you eat can help you modify. So you have access to real-time data like, oh, what I ate was maybe not the best of choices. I'll tweak it tomorrow and see what difference it makes. So there are a lot of options. Of course, this is something we have to take proactively. It's not something we just wish away, but we have to make decisions and take action to control it. So this is hopeful, Doc. So thank you for that. Now, my next question is this. Let's talk exercise. Are there exercises you tend or physical activities that you tend to encourage in your clients or your patients to help them manage their diabetes?
So, the American Diabetes Association says that in order to maintain insulin sensitivity, you don't just need to have 30 minutes of moderate intensity activity most days a week. They actually go on to specify that you should not remain inactive for more than 60 minutes at a time. And so to put that in perspective, like no one can make it through a movie without becoming more insulin resistant. And though this is why your Fitbit and everything are designed to kind of poke at you, say, hey, it's been a while since you moved. That's what you're made for. And the more you move, the more sensitive to insulin you are, the less likely to have spikes and all these other kinds of complications. Now, all chronic disease, whether we're talking about diabetes or heart disease or cancers, these are all rooted in inflammation. And the Western lifestyle is inherently incredibly pro-inflammatory. And there is no medication that's as good as taking a walk or a jog when it comes to combating inflammation. Now, I'll go back to the weight management side and say that, as you age, there's a phenomenon called sarcopenia. Thanks a lot, nature, for wasting away my muscle fibers. This is what happens when people say, well, I turned 40, I turned 50, I had menopause, whatever happened, and I gained all this weight. That is in part sarcopenia kind of hitting the breaking point for you. So go back to the idea of being very metabolically expensive. Okay, lean tissue is very expensive to build and maintain, is very cheap to burn it off. And so any activity you can do that's going to enhance your lean muscle is going to improve your insulin sensitivity and your weight and so on down the road. So again, if in doubt, you reach for protein to feed the lean mass. And if in doubt, you pump some iron so that you develop and maintain it.
I love it. I love it. Movement, and build that lean muscle mass. I love how you talk about like it's free movement. Movement is free. Move, and it doesn't have to be the 30-minute rigid running on a treadmill. Just maintain a level of movement throughout the day, and it helps ward off a lot of things, a lot of complications down the line. Now, my final question before we wrap up. Now, there's a lot.
Yeah,
No, go ahead.
Well, there was a study posted recently about comparing people who did their 30 minutes most days a week of fixed exercise and people who were active throughout the course of the day over the course of 8 hours. And we found that breaking it up throughout the day, even if the number of minutes of activity were the same, had a very dramatically different and better impact on than people who had kind of like done their exercise for the day and then sat at a desk.
Awesome. There you have it. Go ahead. Move on. You know what I tell my patients? I tell them, what do you do? I ask them what they do for work. They work from home, get a sit to stand desk, move on their time. So at least by the time you're done work, you've already done the things. You've already moved for the day. So I'm hoping those who are watching are taking notes, because this is very, very helpful. The problem or the challenge is to do these relatively simple things over and over again. All right. So my next question is this. There's a lot of information online, right? On what to eat, what to do, what not to do. Are there resources that you can recommend for our clients or for patients who are watching, who are like, I'd like to know where I can get information that's tangible, that's helpful, that's useful, that's practical, and that's correct? Are there resources you recommend, Doc?
Yeah, you can go to the American Diabetes Association. They do have a section that's about healthy eating and recipes and all that kind of stuff. We have on our website, which is aidendo.com or AIDENDO.com. There's a section for patient resources is filled with various kinds of diabetic education and other forms of education, and some videos on our YouTube channel as well. They kind of begin to talk about these things. So if you're curious and you've got time and you want to do this at home, that's a good way to start. Then for people who want more education, then I get them in touch with a certified diabetes educator and or dietitian, so that they can develop their skills more.
Awesome. I love it. All right, Doc B, thank you so much for doing this. And I'm sure people are wondering, man, this doc is in the area, and I need to see an endocrinologist. Doc, where can people find you?
So we're pretty easy to find. We're on Matlock Road by Country Club, so equidistant between the two highways. You can call or text us at 817-380-4880, and we'll get back to you and get you scheduled if you want to come in. You can contact us through our website, and you can find us on social media as well. We're trying to have a healthy diet of informative and engaging material for people on our social media accounts.
Awesome. And I put that information at the bottom of the screen for those who want to connect with you. Thank you so much for taking the time to come and speak with us. I know you're busy as well, so I appreciate you doing this for our guests.
Oh, truly my pleasure. Thank you for the invitation.
All right, awesome. For those of you who watch live, thank you for watching. Thank you for the comments. I see you, Miss Adebimpe. I appreciate you for stopping by. As always, please share. Caring is sharing. You can tag people in the comments or simply forward this video to them. And on that note, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will have conversations like this to help you live long and well, I am she. Thanks again, Doc.
My